introduce yourself and make sure it's visible to everybody, that'd be great. But yeah, if there's any like comments that the youth board would like to add to the slide, definitely speak now. But if not, I'll hand it over to Laura, who will introduce Dr. Rice.
Thanks, Travis. Hi, everyone. I just want to say thank you again for being here and for listening into our conversation that we had with the expert board member. I'm really excited to invite Dr. Rice to be with us today. He's been a longtime collaborator with LACEYH, and today he's going to do a presentation on the science behind peer influence. So I'll go ahead and let Eric go, and he'll be able to share his screen with his slides.
Hey everybody, I'm Eric Rice, and I just saw that my rename he, his. I use he and his pronouns, and I'm very happy to be here and being able to be a part of this conversation. I think I was really moved by what I just heard with the slideshow, hearing young people talk about their experiences with peers and the importance of peers and family and how that impacts your thinking. I think that this is really very much in line with what I'm going to share with you all this morning. And so, hey, Laura, remind me, I've got 10 minutes.
Yes.
Okay, here we go. Peer influence in 10 minutes or less. We'll do my best here. So let me just, oh wait, did I get this is the wrong thing. Sorry, I'm an old person, and so therefore I'm dumb about things like technology sometimes, and so I'm pulling up the wrong thing. So let me just get the right thing, and we will be good to go. I thought I had it open, but of course I closed it because I got distracted listening to all of you talk and stopped worrying about what I was going to say next and just was getting into what you all were saying, which was really exciting for me. Okay, now I've got it. Now I should be able to make this happen. Okay. There we go. All right. I'll move this out of the way, and then we'll go to slideshow and play from the start. Okay, so what I'm going to talk about is peer influence and some of the work that I've been involved in for the past several years, really, where we've tried to harness peer influence in the community of youth experiencing homelessness to try to encourage HIV prevention behaviors and testing. And what's really exciting about this for me is that both Robin and Laura were key parts of this work that I did over the last few years, and I certainly couldn't have done any of it without either of them. So I'm honored to talk here. So this is some things that which some of you may know and some of you may not know, but just to kind of give you a little bit of a context about HIV, which was really the public health crisis that we were trying to deal with at the time with this study, was that in LA, there are a lot of youth who are experiencing homelessness each night. 2020 said there's almost 5,000. What you may not be as aware of is the fact that there are a lot of racial, ethnic, and sexual orientation disparities with respect to HIV risk. So, for example, we have unfortunately low numbers of folks who have been tested in the past 6 months for HIV in the African American and Latinx, in the Black Latinx community. We also have a lot of young men that have sex with men who are in the part of the Black community who've also not been tested recently. So there's it is not maybe the newsworthy problem that COVID is, but it certainly is one. So networks can potentially be mobilized to help us deal with public health crises. And one of the things that, from what we're hearing from the interviews shared just a few minutes ago, was that oftentimes people are looking to different sources for their information, right? Not everybody trusts the news. There's a lot of good reasons for that. A lot of people trust their friends and their family much more so. Some people trust the places where they work or official health sites. And what we wanted to do in this particular study was we wanted to make sure that, or this research was to try to leverage the kinds of conversations that young people might be having with each other. So another thing that's kind of interesting to think about is, who do young people talk to? So if all of these dots represent young people and the lines represent connections between young people, we had this one study where what we found out was that some people are acquaintances that people talk to. Those are the gray lines. Some people are friends. Those are the green lines. So mostly we talk to our friends. And then some people are our sex partners. Those are the red lines. So this is what a conversation network amongst youth experiencing homelessness might look like if you drew it out as a graphic. And then this is what it looks like when we asked the same group of young people who they talked to about condoms and using condoms. So you can see that suddenly there's, a lot of those green lines went away. A lot of the red lines went away. A lot of the gray lines went away. And so what we are saying with this is that, there are some, young people that are talking about sexual health with one another, but not enough. And we really wanted to try to mobilize a lot more of this. So what we were doing was we were working on what we refer to as a peer leader model or a peer advocacy model. And the basic concept behind it is that we would work with a small number of young people who we'll call peer leaders, who we would then train to know a lot of facts and factual information about HIV, and how you can get HIV, how you can prevent HIV, the importance of getting tested. And then we asked those young people to go out and talk to their friends about what they had learned, so that just like what we were talking about, earlier in those conversations, we could really spread information that was accurate within the community, when people are maybe not trusting of other sources. And so what we did with this was, and here's a picture of Laura from back in the day. We actually, had a couple of MSW at the time. This is when Laura was a student. So she was an MSW intern for me. And she was working with a group of young people at the time who were actually being trained to go out and do this work and to influence their peers in positive ways. And so what we did with this, the way what the model actually looked like, was that we had a one sort of a half day training, and Robin is the person who really was the architect of the designing this part of the project. We did a half day training where we taught people about HIV and STIs, but we also taught them a lot about communication skills, leadership, and about self-care and some other things that are really important if you're going to go out and do this kind of work. And then we also would meet with those young people who we trained to be our peer advocates once a week for 7 weeks afterwards, to really work with them around what was happening, what problems were they running into, to help them brainstorm how to keep up with their work and to support them. And what we really encouraged people to do was talk to their friends, a little bit on social media, but mostly face to face, which I think, as we're thinking about COVID, and the realities of COVID, this might be a little bit different if we were to apply these ideas to COVID. But still, the idea is that rather than just talking to random strangers who might not value your opinion, if you talk to people who trust you, those are the people who you're really going to be able to influence in a positive way. So we did this work with Safe Place for Youth, My Friend's Place, and the LA LGBT Center. And it took us about 2 years to do all of this work. And we actually involved a total of 714 youth in this study. And we had we actually had 3 different arms of this study. I won't get into this a lot, but basically we tried, one method for picking out our peer leaders was picking the people who had the most connections in the community, popularity. And another one was we used a computer algorithm that was designed by some computer science PhD students that we worked with, who where they used artificial intelligence to try to smartly pick with a computer program the people who would potentially be the ones best able to disseminate this information. But what I'll share with you here is really just kind of how excited we were about how well this worked, right? So if you look at, whoops, I don't know why that jumped back. If you look here, what you can see is that the observation, which is just, this is basically just people who we interviewed over time, that were just receiving normal services at the drop-in centers versus the times when we went in and we tried to mobilize people to influence their friends. And what you can see here is that the number of people who had vaginal sex without a condom in both the yellow bar, which was the popularity version, and in the AI bar, which is the red version, they both of them, the rates go down. And then also when we're talking about anal sex without a condom, you see the same thing. That we see improvements in both of the groups where we had young people out there who were leveraging their relationships with their friends to try to help their community be healthier. And one last thing I'll show you is some of the results about HIV testing. So HIV testing is another thing that we're really interested in. And what this is really just showing is that, when we first met people, there was, about a quarter to a third of folks who needed to get an HIV test. And that what we found was that by the end of our study, we were actually able to get a lot of people to get HIV tests, especially the people that were in our artificial intelligence arm. And so I think maybe what I'll do is I'll take some questions, Laura, because I wasn't quite sure how much I wanted to lecture so much as share the excitement about this. So I think the one last thing that I'll say is that I really believe, and I think that Robin and Laura would agree with this, that COVID and the idea about vaccination and is it a good idea, is it a bad idea, the information that we need to know about COVID in order to, and the vaccines in order to make that decision, getting out information to people is a challenge. And one thing that we've learned over time while we're working with young people who experience homelessness is that young people who experience homelessness are very good at taking care of one another and helping one another when they're when they're in need. And what we also see is that they're very good about connecting to their friends in important ways, and that they did this around HIV prevention. We think that it seems like a really reasonable idea that this could help with COVID vaccine information as well. So I guess I'll take a couple of questions if there are any. Maybe Robin or Laura, you can help me figure out how to even make that happen. I suppose I should stop sharing my screen, right?
Yeah, thank you. I mean, this is so great to see this old work, and we asked Eric to come and present because how relevant all this stuff is to the current ongoing pandemic, and of course to the next steps and next stages of rolling out vaccines and other types of health promotion behaviors. So I'm curious, like, what the young people or what our youth board, if you all have any questions or thoughts on peer influence and peer networks. I mean, some of what came up in the pre-recorded stuff, but any thoughts? You all are a smart bunch.
I'll look at the chat box and see if there's anybody else who's...
Stage, you don't need to raise your hand, just go for it.
Thank you, Dr. Rice, for the presentation. My question is, what have you seen in terms of willingness with young people to get vaccinated versus how folks were getting treated for HIV back then?
That's a really good question. So, when we were doing this work in 2016, 2017, 2018, 2019 is kind of when we wrapped it. HIV had been around for like 30 years. And so people knew that, there was no cure for HIV for the most part. And people knew that there were some things that, you could do to prevent the spread of HIV. And a lot of it is just was working with young people to remind them about the importance of protecting yourself about HIV. I think now everybody's really afraid of COVID, but they don't necessarily know how safe it is to get these vaccines. And so from what I understand from some research that Robin did recently is that young people experiencing homelessness, at least over the summer when they're asked, would you get a vaccine if one became available? So this is long before they were available. I think it was about 40 or so percent said that they wouldn't, that they were suspect of it. And I just saw some data that another friend of mine named Benjamin Henwood, who's another professor at USC, he's done some work with adults who are experiencing homelessness in the Venice Clinic. And one of the things that they found was that about half of the people who are who've been offered a vaccine to date, who are homeless adults, have turned it down because they're concerned about it. So it's, there's definitely, I think, a lot of people who are worried about this. And so, which, there's not really a comparable thing with HIV in terms of like, do you want a vaccine? Because there is no such thing as a vaccine for HIV, but there is this pill that you can take that's called PrEP, and that pill, there's also some concern that people have about side effects, and so not everybody who is eligible to take those pills wants to take them. So it is part of what happens with public health issues, is that people don't know what information to trust. They don't know what's going to happen to them and their bodies, when they do this, and so that can be very scary. So that's a great question. Thank you, Sage.
I'll add a little bit to that too. And I think one of the things and Laura, you can pop in, when we're doing the trainings, the way these trainings were designed to just promote, like be able to provide the information and education, right? So I think like the same thing with vaccines, right, is making sure that young people have the confidence and ability to access like the information to make the best decisions for themselves, for their own health, right? And so there's so much misinformation or incomplete information, or just like being able to, like, such an important part that I found with vaccine stuff is being able to talk through like questions that you have like with peers, right? Versus just like getting berated with like a website, right? And a bunch of information, just gonna be like, well, I don't know what that means or how to feel about that. How do you feel about it? Is such an important part of the conversation, just making sure that we're creating safe and accessible spaces for that.
Yeah, and I think one thing that I dislike about the term, peer influence, right, is that it almost has it suggests that we're trying to convince people to do something, right? And I think that more we know that people are influential to their friends, and what we would like them to be influential about is sharing information so that people can make educated decisions for themselves about, what they want to do. And I think, all of the stuff in the slideshow made it very clear that there's a lot of confusion and misinformation, and some people feel more connected to information that they trust than others, and all of that makes a lot of sense to me.
Yeah. We had one question in the chat. Someone asked about demographic data and comparing BIPOC youth to their white peers when talking about concerns of the vaccine. Maybe that's something we can talk on the panel. The panelists can talk about that, their on the ground experience. In the research we did, we haven't found any differences amongst youth experiencing homelessness. So, but for HIV testing, were there any differences across the
Not really. I mean, it was, and in terms of, sort of the influence for the model, the peers were just as good at sort of sharing information about condoms and HIV testing, regardless of what, race or cultural group or sexual orientation group or gender identity group they belonged to. It was really, but I think that when we designed that study and that intervention, we're trying to be very thoughtful about being inclusive of people of different, we've got different identities, to make sure that, it was good for, for everybody. That doesn't mean it's going to work for everybody though. So, I mean, it was nice that that people felt engaged. Are there any other questions? If not, well, I mean, it's always a pleasure to speak at a meeting like this, and to get to hear the voices of young people talk about issues that are, so, relevant to my own work, but also just to the world. So thank you very much for taking, asking me to be here, and I'm looking forward to hearing the rest of the conversation.
Hey, thanks for coming.
If I can ask a question real quick. Sorry.
Yeah, go ahead.
I guess my question is, in terms of talking about HIV, is that, HIV and AIDS have been an ongoing thing since the 80s. And, you know, all this research has gone into finding, you know, the vaccines or cure or prevention, methods of prevention. But then here we have COVID, you know, another disease, whatever virus that, you know, that's affecting a lot of people. And now the government has invested so much money into, you know, getting a vaccine so quick. So I guess for me, my anger was out of, so have they not been investing enough money to get, or do they not just want to get a, you know, a vaccine for HIV/AIDS, or are they, or is there not enough funding, or what's the reason for us not having, you know, something like a vaccine for HIV now, but under a year we already have a vaccine for
Yeah,
COVID?
it's actually a very scientifically kind of complicated answer, but the short version of it is that COVID-19 is a standard virus, and there's a type of virus called a retrovirus, which is what HIV is. And HIV gets into your cellular makeup in a way that normal viruses don't. And so they're much more difficult to create vaccines for, and they have yet to figure out how to make a vaccine for it, even though they've been trying and funding it really aggressively for a very, very, very long time. So part of it is that the scientific community is more armed for this kind of virus than they were for the HIV virus, which was a really kind of threw the scientific community for a loop, and still is to this day. But I understand your frustration that, wow, we can get this in, you know, under a year, and it's, you know, 35, 40 years later, and we're still, you know, people are still dying from HIV. And, you know, I'm with you on that one. I mean, it's really frustrating.
Sage, did you have one last thing?
Yes, I have one last question for Dr. Rice. Dr. Rice, what is one way that peers can be well informed if they're not tied to any particular agency or educational institution?
Oh man, that's a good thought. I mean, I think you can use, you know, you can use your Google searches to look up information, but but I think that there's a couple of places that have accurate information. So one of them is the CDC. So when you go to the, you know, the Centers for Disease Control, that's the, you know, those are the best, you know, that's the most accurate information. And they usually try to, you know, provide the information in a variety of different ways that are usually pretty accessible for most people. And I think that, you know, and then the other thing is to try to talk to, you know, somebody who's either like a caseworker or a physician or something like this. But I know that some, you know, folks are disconnected from that. So I think that, you know, use the internet to the best of your ability and try to find things that are legit sources. And definitely the CDC is the most legit source for public health information. And that's really the best place to find that stuff. It's not the most exciting website in the world, I'll tell you that, but it's got the information there.
Well, thank you so much for coming, Eric, today. This was great to have you back at LACEYH, in a LACEYH event, and I'm glad the board was able to ask you questions directly. And I'm sure everyone will share your information in the slides and the follow-up emails for folks. So thanks. I'm gonna move you back to attendees. Have a good rest of your afternoon. Bye. All right, so we are doing a little bit of a brief of a break. And Travis, you want to introduce the break?